Assalamualaikum and a very good evening to the honorable panel judges, lecturers and my fellow friends. I am Hannan Safiyan Anuar, and along with me, my research partner Tengku, Fatin, Nabila will be presenting our research entitled An App Based on Diagnostic Tool, a Survey on the Impact of Learning. To start with the presentation, I would like to elaborate more about the background of the study. Oral medicine is a branch of dentistry that lies at the interface between medicine and dentistry and is particularly related to diagnosing and managing oral diseases. Achieving accurate diagnosing of oral disease is critical in formulating appropriate treatment plans for the patient. Learning OM can be challenging for some undergraduate dental students due to overwhelmed theoretical and clinical concepts. At the moment, OM education has been delivered in a customary classroom in all dental schools in Malaysia. So, although additional outside classroom learning is achievable through self-reading of textbook and educational journals, however, the learning process is taxing and students may be easily demotivated. In recent years, there has been a great interest in developing a wide variety of dental apps for interactive and flexible dental education. To date, none of the developed dental apps were designated for OM teaching and learning. Therefore, we developed an application-based diagnostic tool, ODS3 app, a novel method to teach clinical decision-making in the diagnosing of OM-related disease. The app was designed to supplement rather than to entirely replace the old conventional method of teaching. The objective of the study is to evaluate students' perception on the effectiveness of ODS3 app as a learning tool. We want to know how far the acceptance of UiTM dental students towards the designed app. So basically, this is a cross-sectional study. For the development of the app, the ODS3 app was developed based on the decision tree algorithm in diagnosing oral medicine cases using a stepwise progression method. Since the ODS3 app is a pilot study, only 3 diseases were selected for the app development, which comprises of color lesion, immune-mediated diseases, and oral ulcers. A decision tree is a flowchart used to help the clinicians to reach a provisional diagnosis. It's like a step for you to click on the app to find a definite diagnosis. You can see the layout of our ODS3 app in the poster. For the first layout of the app, it contains the home page which user can click on the oral mucosal lesion icon to start the app. Once you click, the second page containing the 3 lesions will appear, so you click on the related disease, for example, color lesion. Then the third page will appear the possible clinical presentation of the lesion based on the case. So users can continue clicking the app based on the clinical presentation until get the possible provisional diagnosis. Despite a few diseases can have similar clinical presentations, for example, white lesion, the advantage of the app is to help the clinician to narrow down the possible clinical diagnosis by differentiating them according to the appearance, characteristic, and site of the white lesion. The Progressive Web app was designed and developed using Quasar framework with Vue.js and was made available for iOS and Android users, mobile phones. Once the app was completed, we constructed a 5-point Likert scales ranging from strongly disagree to strongly agree to evaluate the perception of the students on the effectiveness of the app. For the content validation, the questionnaire was validated by 2 specialists in the relevant field and also from UiTM undergraduate dental students in the 3rd year to gain their feedback on the overall acceptability of the questionnaire in terms of length, understanding, and language clarity. As for the questionnaire, it consists of 5 sections. For section 1, we ask about the demographic data. Section 2 assesses the app content in terms of sufficiency, relevancy, and supplemented clinical features. Section 3, we assesses the app design in terms of structure, layout, and reliability. For For section 4, focuses on the app aptness to evaluate its practicality. And the last part, section 5, we evaluate the effectiveness of learning using ODS 3. The link to the ODS 3 app was distributed to the students, and the students are required to peruse the ODS 3 app prior to answering the questionnaire.
Assalamualaikum, my name is Tengku Fatin and I will continue with the result. From a total of 164 Year 4 and Year 5 students, 100 responses were written, consisting of 60 Year 4 students and 40 Year 5 students, indicating a response rate of 60% equal to 60 and 40% respectively. From the figure 2, a vast majority of the students, which is 98%, prefer learning through the combination of conventional lecture and ODS 3 app. Meanwhile, 1% of them respectively answer to receive lecture alone and app alone. 92% of the students agree that the app design is user-friendly and the layout is well-structured. As figure 1 shown in the poster, 85 of them agreed that the layout is visually attractive. Next, 97 of the students agreed that ODS 3 app promote rapid self-revision, and 95% of the students found that the app is practically useful for undergraduate dental students. All the answered questionnaire data were collected and summarized into table 1 that have been presented in the poster. For the discussion part, in overall, students' perception was positive towards the use of ODS 3 app to complement the conventional teaching method. ODS 3 app was perceived to have a significant impact on learning in the vast majority of students, as it enhanced student understanding by providing an overview of the whole content of oral medicine subjects and the main key point in diagnosing diseases. Foster et al. 2011 in their study inferred that most dental students showed a positive attitude towards the use of technologies as teaching tools. So, for this research study, the clinical pictures in ODS 3 app aid students to get familiar with oral diseases since they get little clinical exposure due to the limited clinical sessions. Not only that, the convenient use of ODS 3 is envisaged to replace the conventional revision session and to aid students in last-minute preparation and revision for their examination or even clinical sessions, as the app reduces the hassle to open up a textbook to find information. ODS 3 app is surmised to greatly benefit the students by improving their diagnostic skills, cultivating their interest in learning oral medicine, and enhancing their knowledge on the clinical presentation of oral diseases. With that, we end our presentation with a conclusion that the use of dental app should be encouraged in dental education to foster cognitive interest and engagement among the undergraduate dental students who live proliferated by digital technologies. With that, thank you.